Hey guys, Lee Tomich here from the Epilepsy Institute. I want to talk about a few patients that I saw this week who are post-operative, just to talk about some of the different outcomes that we sometimes see after various types of epilepsy surgeries. The first patient was having seizures every day, 3 to 5 seizures every day, and we placed a vagal nerve stimulator. This was a multifocal type of epilepsy, so we didn't think that there was a great resectable target. And again, this patient is only about 3 months out from surgery, but the mom is really thrilled because seizures have gone from several times a day to about 1 to 2 times a week. So again, it's not a total cure, it's not seizure freedom, but it's a significant palliation, significant improvement. And again, that family is quite thrilled about the VNS. You know, vagal nerve stimulation is something that we tell patients often that you'll see about 50% improvement in about half the patients that get implanted, and a very small number, excuse me, are totally seizure-free, probably less than 10%, less than 8% maybe. And then some percentage of patients don't see much improvement at all. So variable outcomes, but it's always nice to see a patient like this who gets great results. It's a simple surgery, it's not intracranial. They go home the same day. The other patient I want to talk about underwent a partial corpus callosotomy. Patients who are relatively high functioning, have good gait, but have generalized type seizures, especially with an atonic drop component. We still like to do corpus callosotomy. I think it's a very powerful surgery. And again, in this child's case, he was having seizures on a daily basis, 3 to 5. Mom was frequently taking him out of school, getting called from school. He was having falls. He is still having seizures, but mom describes them as very short and a lot less frequent. So again, several a week now, not every day, but they're much shorter. They don't lead to drops. And again, it's another outcome for surgery that we do that's not seizure freedom, but it's still quite consequential for the family. And when I asked mom, are you happy that you underwent corpus callosotomy for your son? She said, absolutely, no question. And again, it's always exciting to hear that kind of outcome. So those are 2 types of surgeries that we do for palliation or improvement of seizures. They don't always lead to seizure freedom, but even when they don't, I think often there's an improvement in the quality of life, improvement in seizure frequency and severity.